Blepharitis means lid inflammation, or more specifically an inflammation of the lid margin. In each eyelid we have 25 to 30 glands called meibomian glands, and in blepharitis the inflammation starts within these glands. Their role is to produce an oily layer that covers the tear film and prevents the tears from evaporating too quickly. In blepharitis, the meibomian glands become inflamed and the secretions they produce become too thick, so they fail to flow out of the glands and fail to reach the surface of the eyeball. As a result, the tear film evaporates too quickly and the eyes become gritty and uncomfortable and dry. Often this is associated with redness of the eye, as the surface of the eyeball itself becomes inflamed as well. Several factors contribute to the development of blepharitis: environmental factors, hormones, the immune system, nutrition. We know that people who work in offices in an air-conditioned environment, or work on computers for prolonged periods of time, or have to do a lot of studying and reading, are more prone to developing blepharitis. We also know it is more common in women from the age of 40 to 50 years upwards. Lastly, we know that nutrition may well play a part, because the addition of essential fatty acids such as omega-3 and 9 to the diet can alleviate some of the symptoms. We also all have bacteria on the skin called staphylococci, and people with blepharitis have more staphylococci on the lid margins than people who don't have blepharitis. This probably causes the severe inflammation of the eye surface that we see in children with blepharitis, because staphylococci produce a toxin which is very irritant to the surface of the eye, causing inflammation of the conjunctiva, the white part of the eye, and even the cornea, the clear window at the front of the eye. The mainstay, the most important part of treating blepharitis is lid hygiene, both in adults and in children. The minimum you should do if you have blepharitis are warm compresses and lid margin scrubbing every day for at least 2 minutes. Warm compresses can be applied very simply. All you need to do is take a flannel, soak it in boiled water that has cooled down a bit, and then apply these compresses to the closed eyelids for at least 2 minutes, at least once a day. This will dilate the meibomian glands and it will soften the secretions that have become stuck, allowing them to flow out and onto the ocular surface more easily. In children, this can be difficult, but can be combined with their bath time routine and can be turned into a peekaboo game, applying the warm compress to one eye at a time. The 2 minutes of warm compresses then should be followed by a thorough scrubbing of the lid margin. It needs to be quite a mechanical scrubbing effect to be effective, because bacteria on the lid margin secrete a biomatrix, something like a sticky film that they are embedded in and that adheres to the lid margin. To carry out effective lid margin scrubbing, parents have told me that often it is easiest to use the warm flannel again, rub it around the index finger, soak it in warm water again, and then use it like a little brush to scrub along the line where the eyelashes are coming through the skin, on the lower lid and on the upper lid if possible, although in young children this might not be possible. Another way for lid scrubbing is to soak a cotton bud, a Q-tip, in warm water and then use this to massage and scrub the lid margin. My advice for people who suffer from blepharitis, or to parents whose child suffers from blepharitis, is to try simple measures first. So the warm compresses every day, the lid scrubbing every day, and possibly enriching the diet in essential fatty acids. Omega-3 and 9 essential fatty acids can be found in many vegetables and fish and legumes such as salmon, mackerel, avocados, flaxseed, linseed. All these contain a high degree of omega-3 essential fatty acids. In addition, many supplements are available, particularly for children, which contain these substances. If these measures fail, I would recommend seeing a specialist, because in particular if there is inflammation of the surface of the eye, a red eye, and possibly inflammation of the clear window at the front of the eye, the cornea, eye drops are needed to calm down this inflammation. In children, an oral medication can also be very effective, and it has to be prescribed by a specialist and has to be taken for a prolonged period of time, as blepharitis is a chronic condition that needs to be addressed patiently over time.